Hello, I'm Dr. James Bogash, expert in health and longevity and creator of Bogash Life and Balance. And for the past almost 25 years, I have constantly been on a journey to help people make better lifestyle choices. And the power in lifestyle choices is unquestionable. If you want to not have a heart attack or not have a second one, there is nothing more powerful than the choices that we make every day as it relates to diet, exercise, and environmental exposure, stress, sunlight exposure. These tools are our most powerful tool, period. Regardless about whether we're talking a communicable disease like COVID or influenza or a non-communicable disease like obesity, diabetes, heart disease, Alzheimer's. They are the most powerful tools we have at play. Certainly, it's not to say that there aren't others. Certainly, vaccination has been shown to lower disease severity and hospitalizations and deaths, even though that is coming under question as time goes on. But I would still contend that the choices we make are still more powerful than anything that could be done by science. In other words, healthier living through science just doesn't exist. The frustrating thing is that we have been just bombarded with the opposite message of fear, and there's nothing you can do, and you are totally out of control, and that leads to things like stress. Because we are stressed because we think that there's nothing we can do about this, despite the fact that I have not seen a study that shows that obesity protects against COVID, or that smoking would protect against COVID, or that diabetes would protect, or that vitamin D deficiency would protect. They just don't exist. So I just am sick of hearing people saying that lifestyle isn't the answer, and maybe it'll make a little bit of difference. The reality is that's just not true. And we don't want to admit this, because then there's some degree of responsibility for what we do and the choices that we make. So if we see that one person out of 1,000 who lived a healthy lifestyle, and oh my God, they got COVID and ended up on a ventilator, well, that means that I should sit on my ass and I don't have to do anything, or I'm going to order fast food through StubHub, through Grubhub, because it's not going to make a difference, because look at that one person over there. Well, that's playing against the odds. So the data still continues to suggest that the choices you make are going to have a huge impact. Just to drive that home, I'm presenting two studies, one on overall lifestyle and one on exercise. The one looking at exercise, and again, the argument, people are like, oh, well, that's not peer-reviewed, even though most of what we've done, the decisions we've made, have been done under with preprint. So we like to use that discussion or argument that this is preprint, it doesn't count, and yet we'll use it preprint when it works in our favor, that we should not exercise or sit under duff or promote this or that, or not promote this or that. So these are two peer-reviewed published studies. The one is on look at the almost 31,815 cases of people with COVID, and they found that those with higher diet quality, and there were certain markers. It's not going to take a brain surgeon to figure out what a higher diet quality is, but it was a 9% lower chance of somebody being a case, meaning positive PCR. So just a healthy diet lowered the fact that somebody would be test positive. Period. Not severity, not just even having a healthier immune system. Your immune system stopped it at the door and said, you know what, you can't come in. So 9% is not dramatic, but it's more of a difference than masks will make by magnitudes. And as far as severity case, 41% lower risk of of bad outcomes with COVID if you had a healthier lifestyle. Now, interestingly enough, in this study, they also looked at something called deprivation. Deprivation has a lot to do with socioeconomic status. There are some things that go into that, but you can imagine lower socioeconomic status played an even greater role in people who had poor diet. So in other words, if you're living in Manhattan and you're eating fast food, that might not be quite as bad as living in the Bronx and eating fast food. But all this money that we've thrown at COVID and the pandemic has, if anything, it's made things worse. As far as our socioeconomic status, people have gone down, not gone up. There's been a greater gap. So clearly diet played a role in cases and severity, and then exercise. Like we've gone the opposite direction where we've closed gyms. In some places you can't even go outside and exercise. There's been some crazy things. People getting ticketed on the beach. They're surfing outside in California. But this was a study looking at almost 50,000, so 48,440 people, and they broke them up into consistently inactive, so less than 11 minutes per week. This is, I don't know, but I don't even know what to say with that. They looked at the consistently active, so 150 minutes per week. You're looking at, math. If you wanted to exercise every day, that's not even, so 150 minutes is not even 3 hours, 2.5 hours. It's not that hard to do that, and their level of activity is not what I would consider active. Certainly walking around the block constitutes as exercise, but it's not what I consider exercise and healthy, and it's below what almost everybody can do. But they still found that those who were, when they compared the consistently inactive, the sit in your butt on the couch, to the people that were consistently active, those people that were consistently inactive, 226% higher risk of hospitalization, 173% higher risk of being in the ICU. Like, that's massive. Just from getting off your ass and moving will change the trajectory of what might happen if you get COVID. Like, you can't get clearer than that. Then when they compared the consistently inactive to the moderately, so just more than 11 minutes, I'm sure it's not the 12-minute-a-week people, but you get the idea. If you were moving just a little bit more compared to people who are consistently inactive, 132% higher risk of death if you were not moving compared to just moving just a little bit more. This is not the message that is getting out to people. As a matter of fact, I think it was Delaware that somewhere, one of the counties in the northeast states, one of the counties basically said, hey, you don't need to exercise. It takes a lot of exercise, running, jogging 5 miles a day for a week to take off a pound. Instead, just go get vaccinated. That's the complete opposite message. It was quickly pulled down, but oh my God, like, what public health agency would tell people that you shouldn't be moving? We've gone the complete opposite direction, and it's a travesty. I can't explain how upset this makes me that public health has had no message about the choices that we make. And so when people don't hear it from the public health, they don't think it exists, and then they're going to say, oh, well, I don't have to do anything because it's just not true. And it couldn't be further from the truth. As always, I will post a link to both of these studies in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.